mean, the first thing is really making sure that you've got the right diagnosis. So everything involves, there's always a process in the lead up to that, which is they may have gone through their GP and they've had a bit of a cold and they've gone back and, it still hasn't gone away, so the GP's done some tests and, and there's a suspicion of something, it could be cancer, they might have had scans or something like that. It's the most important step actually in the whole diagnosis if there's getting a sample of tissue and getting the right sort of diagnosis. And then once we've got that confirmed, I never predict anything. I must say I'm not a betting man at all, and I wouldn't. I've seen cases where you think, yes, it could very well be cancer, and it's turned out that it's been an infection. And I've seen it the other way around, where everyone thought it was, an infection or a benign lump, and that's turned into a sort of a cancer that can spread and therefore needs sort of chemotherapy and things like that. So from that point, it's really about just sitting down with the young person themselves, and then anyone else that they want in the room at the time. So if they want brother or sister, I've had people that have had their siblings in there, I've had people that have had their parents in there, I've had people that have just had their partner or a close friend, and it's really about just making sure that there is someone else there. I think it's always important to have someone else there, because the moment you actually say the word cancer, pretty much every other word I say goes out the window, and I don't expect them to sort of hold on to anything, and so I try and keep everything fairly simple. I try and keep it in terms of, yes, it's cancer, it's this type of cancer. Please don't Google. If you need information and things like that, we can sort of recommend sites and things like that will, because even though you can give a name, it doesn't necessarily fit. And a lot of the cases that people might find on the internet, which is a great resource, but can also be, the horror stories and things like that, and that can be pretty confronting.